Good afternoon, ma'am. I am Nurhata Mukram, a student nurse, and today I would like to do a return demo entitled Specimen Collection. So, specimen, it is a sample taken from the patient's body to use in diagnostic and laboratory examination. So, there are some types of specimen collection. So, we have clean catch or midstream urine collection, 24-hour urine specimen collection, urine specimen collection from an infant, catheterized urine specimen collection, stool specimen collection, sputum specimen collection, and the throat swab culture. So there are some special considerations in doing this procedure. So the first one is the procedure of specimen collection may vary depending on the type of examination, and an appropriate container must be clearly labeled, tightly sealed, and sent promptly to the laboratory. Proper precaution must be taken to prevent loss, spillage, and contamination of the collected specimen. So, instructions to the patient must be clear to ensure proper collection of specimen and to help allay anxiety, and laboratory requests must be completely and accurately filled out. And also, there are some nurses' rules in specimen collection. The first one is patient's interaction, suitable selection of supplies, appropriate and proper collection, precise samples identification, up-to-date transfer to the lab. So the first specimen collection that I would like to demo is all about midstream or clean catch urine collection. So midstream or clean catch urine collection is the most common method of obtaining urine specimen from adults, particularly men. This method allows a specimen which is not contaminated from the external sources to be obtained without catheterization. It is important to follow the clean catch protocol in order to have accurate result from an uncontaminated sample. So the purpose of midstream urine collection is the clean catch urine method is used to prevent germs from the penis or vagina from getting into a urine sample. And it is a method of collecting a urine sample for various tests including urinalysis, cytology, and urine culture. And also, it is valuable for confirming alterations in metabolisms, infections, and fluid volume problems to determine appropriate antibiotic to administer to a specific patient. So the materials or equipment to be used in this procedure is container with warm water, soap, washcloth, antiseptic swab or cotton balls, sterile specimen container, label for the container, bedpan, and the non-sterile gloves. So for the planning, determine any special needs of the client, determine what urine test is requested, determine and obtain what articles are needed, and to obtain non-contaminated urine specimen for culture and sensitivity. So the next specimen collection is all about 24-hour urine specimen collection. So it is performed by collecting a person's urine in a special container over a 24-hour period. It always begins with an empty bladder so that the urine collected is not left over from previous hours. So this specimen shows the total amounts of waste the kidneys are eliminating and the amount of each. So the purpose of a 24-hour urine collection is non-invasive or the skin is pierced. It used to assist kidney or renal function and detect diseases. And it also provides means to measure the concentration and dilution of urine. So again, in doing the procedure, you must first identify the client and explain the purpose of the procedure, and then give instructions to clients watcher if around. Then place in client's bathroom stating that 24-hour urine collection is in progress with date and time. Then discard first voided specimen and then collect all urine specimens thereafter until same time the following day. Then place store in a refrigerator or at room temperature of 20 to 24 degrees Celsius. After the last voided specimen is placed in the container, cover and send entire specimen to the laboratory promptly following the agency's protocol. Then after that, you must wash hands to remove the microorganism and then remove sign and remind client that the test is completed. And if the specimen is accidentally discarded, obtain a new container and note the new date and time and restart the procedure. So for the next procedure is we must have the urine specimen collection from an infant. So a pediatric urine specimen is collected from infants who are incapable of telling the time of urination and following direction for collection by themselves. And the purpose of this is to collect pediatric specimen accurately. So the materials or equipments to be used are the following. We have the cleansing swab or cotton balls, and then the towel, and then the pediatric collector, and then the diaper. So the first steps in this procedure is the apply urine collector to the child by placing child's penis through the opening collector if it is male. Then placing the opening of the collection bag over the child's urinary meatus, avoiding extensions over the anus. Check the collector every 15 to 20 minutes. Remove collector if already filled with urine and place a clean diaper on the child. Then pour urine into the specimen container. Close it properly and label the container and double bag it and then send it to the lab. So for the evaluation, you must evaluate urine specimen obtained and then evaluate laboratory requisition if filled out completely. So for the documentation, you must record method used to obtain specimen and then record amount, color, and odor of the specimen and then record condition of the perineum and then record times specimen was sent to the lab and received by the lab technician. So the next procedure is the catheterized urine specimen collection. It is the collection of urine specimen from the urinary catheter. So the purpose of this is to obtain sterile urine specimen for microbiological analysis. So the next procedure is the stool specimen collection. A stool is a waste material eliminated from the bowel. A stool culture is the process of growing or culturing organisms existing in feces to see if any of them cause disease. The most common is the ova and parasite test, a microscopic examination of feces for detecting parasites such as amoebas or worms. Stool specimen is often tested for blood. Guaiac or hemoccult tests may be done in the laboratory but are sometimes done at the nursing station to test a stool for occult blood. So the purpose of this is to determine the elimination status of the client and to identify GIT dysfunction. So there are some types of stool examination. The first one is the routine fecalysis. It is a stool exam used to assess gross appearance of stool and presence of ova and parasites. The second one is the stool culture and sensitivity test. It is a stool exam used to assess the specific etiologic agent causing gastroenteritis and bacterial sensitivity to various antibiotics. Then the last one is the Guaiac stool examination. It is a microscopic study of stool for presence of bleeding in the GIT or occult blood. Then for the materials and equipments to be used are the wide mouth bottle or disposable wax box, the tank depressor, the clean bedpan or bedside commode, tissue paper, washcloth, soap and water, sterile test tube, and sterile cotton applicator or for stool and CNS. And then the container label and then the clean gloves. So again, you must first identify the client and explain the purpose of the procedure, and then wear gloves, and then if the client is able to go to bathroom, give him or her needed instructions. And then provide privacy and place client in med or high rollers positions, place bedpan, and then ask client to bathe first, clean out urine from bedpan, and then pat back the bedpan, instruct client to defecate, raise side rails, and then place the cool light within reach and leave the client if it is safe to do so. And then remove bedpan after defecation and cover it, and then help the client in cleaning perineum. Take the covered bedpan to comfort room, obtain a small portion of fecal material and place it. And then place it carefully in the specimen container. And then clean the bedpan, remove gloves and wash hands, and then send the specimen to laboratory immediately. And then, for the evaluation, of course, you must evaluate first the physical response of the client, and then evaluate specimen and laboratory acquisition if filled out completely. And then for the documentation, record the following: time and specimen was collected and sent to laboratory, the description of the stool, and condition of the perineal skin. For the next procedure, we have this sputum specimen collection. So sputum is a deep cup phlegm collected for a laboratory analysis, and it is a sample of materials expelled from respiratory passages taken for laboratory analysis to determine the presence of pathogens. Specimens are often taken for 3 consecutive days because it is difficult for the patient to cough up enough sputum at one time. An organism may be missed if only one culture is done. So for the purpose, a sputum specimen is obtained for culture to first identify the microorganism responsible for lung infections. Second, identify cancer cells shed by lung tumors. Third, aid in the diagnosis and management of occupational lung diseases. So there are some types of sputum specimen collection. The first one is the sputum culture and sensitivity test. It is a sputum examination assesses the specific etiologic agent of the respiratory tract infection of bacterial sensitivity to various antibiotics. Then the second one is the acid-fast bacilli staining or AFB. Is a collection of sputum specimen for 3 consecutive mornings to assess presence of active pulmonary tuberculosis. Then for the third one is the cytologic or papaniculae sputum examination. It is assessed for presence of abnormal cancer cells. So there are some special considerations in doing this procedure: that early morning sputum specimen must be collected, then collect sputum specimen of CNS before the first dose of antimicrobials is given to client. Then use face mask as protective device if client is suspected PTB case, and then note client's tolerance to procedure. So the materials or equipments to be used are the following: sterile sputum specimen container with cover, and then label for specimen, and then the emesis basin, and then the tissue paper, small plastic bag for delivery of specimen to laboratory, and then the glass of water, and then the face mask. So the first step in this procedure is you must wear mask as a protective device, and then explain the procedure to your client, and then provide privacy and assess client to a sitting position if not contraindicated. Then instruct client to rinse mouth with plain water and ask to do deep breathing before collection of specimen. And then ask the client to cough deeply in order to hack up lung secretion into a sputum container. And then after that, you must cover the container, label accurately and place in a small plastic bag. And then wash hands and remove mask and send specimen promptly to the laboratory. So for the last procedure, we have a throat swab culture. A throat swab culture is a laboratory test that is done to identify germs that may cause infection in the throat. It is most often used to diagnose strep throat. So, we must consider the following. Collect sputum specimen of CNS before the first dose of antimicrobials is given to client. Use face mask as protective device if client is suspected PTB case. Then note client's tolerance to procedure. And then for the materials or equipments are the following. For bacteria, we have culture swab or equivalent collection system. All others, virus, chlamydia, mycoplasma, collection pack. Then label for specimen, emesis basin, tissue paper, small plastic bag for delivery of specimen to laboratory, then glass of water, and then the face mask. So again, wash hands thoroughly, identify client and explain the procedure, and then provide privacy and assist client to a sitting position if not contraindicated. And then, cotton gloves, surgical mask, and protective eyewear to prevent risk of transmission. Then have the patient face a strong light to ensure the area to be swabbed is visible. Then have the patient tilt their head backwards, open their mouth, and stick out their tongue. And then after that, use a wooden tongue depressor to hold the tongue in place. Without touching the sides of the mouth, use the sterile flap swab to swab the posterior nasopharynx in the tonsillar arches. Then insert swab into sterile liquids AMES transport system. And then break the swab handle at scored breakpoint line. Then replace cap and tighten to secure. Then remove and aseptically dispose of gloves and mask. Label liquid AMES vial with appropriate information, then send specimen promptly to the laboratory. Then, for the evaluation, evaluate client's respiratory status if maintained during and after the procedure. Then evaluate the specimen collected, and then for the documentation, record the following: the time the specimen was collected and sent to laboratory, and then the respiratory status of the client.